So I want you to march at your own speed. Don't follow my pace exactly. Just march at a pace that feels comfortable to you and at an effort that feels very easy at the moment. So my name is Chris. I'm the Specialist Exercise Physiologist here at Royal Wolverhampton NHS Trust and the lead for the Cardiac Rehabilitation Service. Throughout this warm-up and cool-down, we'll be working with your RPE, which is your rating of perceived exertion. This is how hard your heart rate feels, how your breathing feels, and how the muscles feel. At the moment, your rating of perceived exertion, or RPE, should feel quite low, as we're just starting off, and we're just gently moving the feet, swinging the arms as much as you feel comfortable, and just gently getting the blood flowing through the body. A warm-up is important before you do any period of moderate intensity activity to allow the body to realise that we're exercising and to prepare the muscles and, more importantly, the heart for the workload we're about to create. By gradually increasing your pace and your range of movement, we will prepare those muscles that we're going to use in a moment for the exercise that we're about to do. It's important to do a warm-up prior to any bout of exercise that is a moderate intensity, so that the body is prepared for the exercise. We'll be looking to only get to an RPE of around 11, which is a light activity. So you should feel that your breathing has increased slightly, your heart rate has increased slightly, but it's still very comfortable. So we're going to continue to march now, nice and gently as we go along. If you want to, you can start to increase the pace slightly, swing your arms a little bit more, but still working at a pace that is comfortable to you. So bringing in the shoulders now, keeping the feet moving, we're just going to roll the shoulders in a nice big movement. We're going to go 5 times to the back, keeping the feet moving throughout, and then we're going to swap and we're going to go forwards. Just rotate the shoulders forwards, a nice big movement, as comfortable as you feel. Then we're going to go back to just marching. Again, swinging the arms, thinking about the speed, make it feel just a little bit quicker, but still comfortable to you. Then we're going to bring in the ankles now. So nice and gently, just tap the toes in front, stretch the foot out, feel a little stretch down the front of the shin, just as you stretch each foot in front, tapping the toes. Just to loosen up the ankle, mobilise the joint, and then we'll go back to a march. So start off a little bit slower, and gradually throughout the march, just increase the pace. Still should feel very comfortable, probably around an RPE of around 9. So we know we're doing something, but it's still quite easy. If you want to, you can start to swing the arms a little bit more, increase the pace. Then we'll go back to the ankles. This time though, we're going to dig the heels. We're going to curl the toes back. Should feel a little stretch down the back of the calf or the back of the lower leg. As you dig the heels in front, curling the toes, and again, mobilising that ankle joint. Making sure you're keeping your balance between each dig. So just do the pace that allows you to do that. Okay, and then we're going to go back to marching. Should start to feel that your breathing is a little bit heavier now, only slightly though. Heart rate starting to climb, still comfortable. We're still only working between around a 9 and an 11 on your rating of perceived exertion or your RPE. So we're going to start to swing the arms a little bit more. Again, you don't need to follow my pace exactly. Just looking to increase the effort nice and gently as it feels comfortable to you. We're going to go back to the toe taps next. This time though, to make the effort a little bit greater, we're going to bring in some bicep curls or arm curls, just to make the heart work that little bit harder as it provides blood to both the legs and the arms. So we go back to toe taps again, just tapping the foot out in front, stretch across the front of the shin, down the front of the foot, and then when you're ready, just bring the arms in. So you're tapping the toes and curling the arms at the same time. Again, go at a pace that's comfortable to you. It is a warm-up. We are trying to make the effort become a little bit greater as we go through, but we still want it to feel nice and comfortable. Okay, we're going to go back to marching. So breathing should be increasing nicely now. Still comfortable. Again, you can swing those arms, increase the effort slightly, or we can do it nice and slowly, whatever feels comfortable to you. So change the pace for your own ability. And this time again, we're going to go back to heel digs and bring the arms in again, just to increase that workload and to make the heart rate increase and the breathing increase slightly. So we're ready, we'll go for heel digs again. So digging the heel in front, again nice stretch down the back of the calf, curling the toes back, keeping your balance between each one, doing it at a pace that feels comfortable to you. When you're ready, bring the arms in, curling the arms as you dig the heels, making the heart work a little bit harder as we go through. Keeping your balance throughout, making it feel nice and comfortable. Then we're going to go back to the marching. So breathing should be raised now, should feel nice and comfortable, but the overall intensity should still feel quite light. So we're going to stop next and do a mobilisation exercise for the upper body. So we're just going to rotate. I want you just to rotate as far around as you feel comfortable. You don't need to go as far as I do. Just work within your own limitations and your own range of movement. So we're going to stop there, feet wide. Make sure you've got a good base. Fold your arms in front, and then we're just going to twist to the right and back to the centre. Twisting to the right and back to the centre. Again, just go as far as you feel comfortable each time. Feeling a little stretch as you do. And making sure you're keeping your balance and maintaining your posture throughout. You can hold it on the last one with a little stretch, then back to the centre and then over to the left. Again, just rotate as far as you feel comfortable, coming back to the centre each time, maintaining your posture throughout. Again, you don't need to copy the speed I do exactly. You can go at your own pace and twist as many times as you feel comfortable. Again, on the last one, hold it with a slight stretch and then back to the centre. Before we do the next one, we'll go back to marching just to get the heart rate back up. Keep the blood pumping around the body. So this time we're going to do some side bends. So a similar posture, feet wide, and we're going to bend to the right, getting a stretch down the side of the upper body. Okay, so we'll hold it there, feet wide. Make sure you've got a good balance, good posture, hands down by your side. We're going to start off bending to the right. So lean as far as you feel comfortable, coming back up to the centre, moving at a pace that maintains your balance throughout, and just having a slight stretch down the opposite side to the direction of the bend. Keeping it nice and gentle at a pace that is comfortable to you. And then again, hold it on the last one, up to the centre, make sure you've got your balance, and we're off down the other side. Nice and gently, reaching down the leg, going as far as you feel comfortable, and coming back up to the centre. Again, go at your pace. And then hold it on the last one, slight stretch, and back up to the centre. Back to marching again. Let's get the breathing and the heart rate climbing. So you now should be marching at a reasonable pace, at a pace that you feel is a little bit more challenging, but we're still only looking to be getting to an RPE of around 11. So quite a light activity. So we're going to do some upper body stretches now. So standing again, feet wide. If you can, bring your arm across your body, above the elbow, and pull in. You're looking to hold the stretch for around a count of 15. And then relax, across the other way, and pulling in. Again, just put as much pressure as you feel comfortable, and count to 15. If you've got the range of movement and the flexibility, you can go behind your head and very gently pull on the elbow, pulling the arm down behind your head. Again, counting to 15, and then relax and do the other side. Again, behind the head, grab the elbow, a little bit of pressure, pulling the arm down behind the head. Count to 15 and relax. Back to marching again. Should all be feeling a little bit warmer now. Breathing should have definitely increased, but still comfortable. So we're going to loosen up the hips now. We're going to tap out to the side. Only go as far as you feel comfortable. So if you want to do them a little bit closer to the centre, you can do, or stretch out within your own range of movement. What feels comfortable to you? And then back to the centre, back to marching, swinging the arms. Still working on the hips, we're going to tap out to the back. So again, think about your balance, think about how far you stretch to the rear. Make sure you can maintain your balance and your posture within this movement. If you want to make it a little bit more demanding, you can bring the arms in as well. So like we mentioned at the beginning, making the body provide blood to the arms and the legs at the same time will just increase that workload. Okay, come back to marching. So we can do some leg stretches now. So make sure you've got space. So, right foot forward, left foot back. Make sure both feet are facing the front and both feet are flat on the floor. Just bend the front knee until you feel a slight stretch in the back leg. If you want to at this point, you can take your hands behind your back and gently lift away. All stretches are done for around 15 seconds. So hold the stretch, then relax the arms. At this point, if you want to, you can shift your weight directly onto your back leg. Your front leg is now straight, placing your hands on the bent leg for balance, leaning forward from the hips as far as you feel comfortable, Now we should feel a stretch on the back of the thigh. Again, hold all stretches for around 15 seconds. Toe down, weight onto the front leg, making sure you've got your balance. Swap legs. So right leg is now back, left leg forward, both feet are flat on the floor, feet facing forwards, bend the front knee until you feel a stretch in the back leg. This time, if you want to join your hands in front and gently stretch away. You should feel a stretch in the calf and in the upper back now. Then relax the arms, shift the weight onto the back leg, keeping the balance, hands on the bent leg, leaning forward from the hips until you feel the stretch on the back of the thigh, and again holding it for around a count of 15 seconds. Toe down, weight onto the front leg. Now I'm quite fortunate, I've got something to use as balance. If you've got a chair, a sturdy chair or a worktop, use that for your balance. Then you want to take your ankle or the back of your trousers, bring the heel up, knees as close together as possible, standing nice and straight and feeling a stretch down the front of the quad. Again, hold all stretches for around 15 seconds. Leg down gently, change legs. Again, take the ankle or the back of the trousers, bring the heel up, knees together and stand up straight. Leg down gently again. So before we go back into the workout, or before we start the workout, just going to have a little march. Just get the breathing increasing slightly, get the blood pumping around the legs, ready for the workout. So we're going to move now into the workout section of our exercise routine. Thinking about your RPE, we'll be moving now from 11 to 13 with regards to your effort. Your breathing, your heart rate and your muscles will feel more challenged during that rating of perceived exertion. It should still be comfortable, you should still be able to talk, but you may not be able to hold a full conversation. Within the workout, I'm going to give you lots of options. We're going to have a cardiovascular component and we're going to have an active rest or muscular resistance component. Within the cardiovascular component, I will demonstrate an exercise and you can complete this exercise from anything from 30 seconds to 2 minutes, dependent on your ability. We want you to progress that duration over weeks rather than days as your body adapts and you tolerate the cardiovascular exercise greatly. Within the active rest or muscular resistance component, we're going to be looking to do 10 to 15 reps. I have got some dumbbells here to demonstrate the exercises, but at home you can replace those with tins, cans or bottles. All activities have 3 versions. We have a post-surgery version where you may have been told to limit the amount of weight you use through your upper body. And then we have 2 progressions with a lighter weight and a slightly heavier weight. I will demonstrate all of those so that you know how to progress. With your first routine or your first attempt at the workout, we would always advise that you take it quite easy. Give yourself chance to build up to the activities and see what your tolerance levels are like. If the first activity is easy, that is fine, you've got somewhere to build to it. There are no shortcuts to improvements in ability and fitness, therefore we need to give the body chance to adapt and respond to the overload. Be sensible with the weight you choose and your progressions should be nice and gradual. So we're going to do step ups now as our cardiovascular exercise. You can have 2 heights of step. Some steps in your back garden may be a little bit lower and some steps on the bottom step of your stairs in your house may be a little bit higher. So stepping up, once you've chosen your step that is comfortable to you and your ability, make sure you step up with a complete foot on each step, making sure you're not half stepping so that you keep your balance at the top and the bottom of each movement. So moving into lateral raises, if you're a post-surgery patient or a beginner, they can be done with body weight, just moving through as big a range of movement as you feel comfortable, lifting the arms up and down in a controlled manner. Moving the arms more slowly will make the muscles work that little bit harder to lift your own body weight throughout this movement. So lateral raises with a weight. I've got dumbbells, but you can use cans, tins or bottles to replicate this movement. First version is with a nice light weight so that you can keep a nice smooth movement throughout. The progression for this activity is simply to choose a slightly heavier weight, whether that's a slightly bigger bottle, maybe a milk bottle, or a slightly heavier dumbbell. So we're moving on now to high knees or marching on the spot. So you've got two options for this activity. We can go to a nice gentle march where you're swinging your arms and marching at a pace now that you feel is quite challenging. So again, your breathing should be elevated, your heart rate should be elevated, and we should be finding this activity a little bit greater. To make the activity even higher, we can bring the knees all the way up, nice and gently. You can leave the arms out, so you can just focus on the knee raises. Like I mentioned in the introduction, this activity can be done anywhere between 30 seconds to 2 minutes, dependent on your ability and your current fitness level. So we've got marching on the spot, high knees, or if you want, bringing the arms and the legs into the movement at the same time. So wall press-ups, again for body weight or post-surgery patients. We're just going to push him forward, contracting the chest, feeling the muscles in the arms and the chest as we move forward and out, and as we come back in, nice and slow, controlling the movement throughout. Feel the chest contract as you come forward and your arms become apart. The first progression then is for body weight or post-surgery patients. The next level is a wall press up. I'm quite fortunate that I've got wall bars, but as long as you've got a flat wall with nothing that you can knock off, place your hands slightly wider than shoulder width and in line with your chest, lowering yourself down slowly and pushing yourself back up so that your arms are slightly bent at the top. Lowering yourself down slowly and back up, feeling the muscles work across the chest and down the back of the arms. The progression for this activity is simply to place your feet slightly further away, as long as you can maintain your balance and your hands are not going to slip down the wall. So the easiest version is to stand quite close and just lowering yourself in, pushing yourself back, nice and controlled both ways, and the progression is to move your feet slightly further back and complete the movement in a nice slow manner. Shuttle walks. So find a space in your house, usually the hallway is a good example. Just making sure your turn isn't too sharp, and again keeping the pace nice and challenging. Just take care with the turns, making sure you keep your balance throughout. And just if you want to, you can walk a little bit quicker once you've turned to make it that little bit more challenging. Remembering your RPE, you want to be working between 11 and 13. You want your breathing to be a little bit more challenging. And you can do this activity again between 30 seconds and 2 minutes, depending on what feels comfortable to your ability and where you are within your recovery. Okay, next exercise, sit to stand. So the easy version or the beginner version is simply to do a knee extension movement, straightening, alternating legs and lowering down in a nice, slow and controlled manner. Feel the muscle on the top of the thigh contracting as you straighten the legs up to almost straight and back down. Again, in a nice slow and controlled movement to make the muscle work throughout. The first progression is to use the chair for a base, keep your arms folded and just stand to straight and back down. Keeping your balance throughout, making sure you've got your balance between each part of the movement as you stand straight and as you lower yourself back down onto the chair. Again, in a nice, slow and controlled movement to allow the muscles to work throughout the positions you're putting the body into. The last progression for this one is to simply step forward from the chair and lower yourself down within that technique. You can feel the chair slightly behind you, just to remind you how low to go. Again, you can range of movement, you can lower yourself only slightly as a progression, and you can lower yourself all the way down. You can judge this on your own ability. Next exercise then is half starts or side steps. So the easiest version is just stepping to the side like we did in the warm-up. Again, step out as far as you feel comfortable, making sure you keep your balance in between each step, and start to go a little bit quicker now at a pace that feels more challenging to yourself. If you want to move that into a half star and bring in the arms in at the same time, which will increase the workload, make the heart and the breathing a little bit more challenged, you can do, or we can just keep it nice and gently down at the bottom, tap into the side, going as wide and as quick as you feel comfortable, or bringing the arms in and making the workload even greater. So upwards row, again for post-surgery or beginners, just bringing the hands up to the chest, leading with your elbows, lifting to a slightly higher position than your shoulders, feeling the muscles across the top of your shoulders and your bicep contracting as we lift up. The next progression is to use a light weight. Again, lifting the elbows up to chest, bringing the weight up to chest height, elbows slightly higher than your shoulders, controlling the movement both ways as you lift and lower the weight. The third progression is to have a slightly heavier weight. So if you are using tins, cans or bottles, just find a slightly bigger object to use to increase the progression of this exercise. Okay, so the next activity step into the back. So again, slightly quicker, increasing the pace as you feel comfortable, going as far back as you are able, keeping the pace a little bit quicker now. If you want to make it even greater, we can go into a slight backwards lunge, keeping your balance throughout, making the muscles work a bit harder as you lunge deeper. Or we can keep it at the beginning, just tapping the toes behind or tapping the toes further back, making it a little bit quicker, or going all the way into a reverse lunge. Keeping the balance throughout, making sure your posture's good and you're going at a pace that is challenging to you. So the next exercise is medicine ball lifts. For post-surgery or beginners, we can just do the movement without a weight. So what we're going to do, we're going to imagine picking a weight up to chest height, lifting it above the head, back to the chest. As you lower it to your legs, a little knee bend and bring back up. So curling the weight to your chest, back to the legs, lowering down. Again, the depth of the squat can be progressed as you feel comfortable. The next progression is to use a medicine ball, or if you haven't got a medicine ball, a bag or a light weight that you can hold in both hands. This time you're just going to go out in front, back down onto the legs, little knee bend and curling it back up. Nice slow and controlled movement throughout, thinking about your posture, thinking about your balance. The progression is when we get to here, is to now push the weight above the head and back down. Curling it to the chest, pushing above the head, back to the chest, back to the legs and bend the knees. The depth of the bend can be progressed and can be adapted to your own range of movement and your own ability. So again, we're going to go back to marching on the spot or high knees. So again, the pace should be a little bit more challenging, arms swinging, as comfortable as you feel. Then we can grade the high knees, so we can do half high knees, where we're just coming up halfway between your hips and their normal resting position, or we can go all the way up as high as your hips, depending on your mobility and ability and what you feel comfortable. But this activity should be challenging now. You can complete it for 30 seconds to 2 minutes, dependent on your ability. So we can start here, just with marching on the spot, or half knees, or a full knee raise, all the way up at a pace that is challenging to you, making the breathing and the heart rate work that little bit harder. Bicep curls. So again, for beginners or surgery patients, you can just lift the weight nice and gently, just with your arms, no weights in the hands, just contracting the arm as you curl up and lowering down. 10 to 15 repetitions for each exercise. The progression, to take a light weight. Again, I've got dumbbells, but you can use tins or cans or a bottle as we curl the weight. Can be done with individual arms, or we can curl the weight 2 arms at a time, controlling the movement up and down throughout. The next progression, to either increase your object or to have a slightly heavier dumbbell to make the arms work that little bit harder, dependent on your ability and your fitness level. So this time we're going into heel digs. Again, at a pace that feels comfortable to you. A little bit more challenge than we did in the warm-up. You can bring the arms in to increase the workload even more so. Going at a pace that you find challenging, thinking about your RPE, 11 to 13. And again, if you want to make it a little bit harder, we can step forward into a lunge movement and back up, keeping your balance throughout, going as deep as you feel comfortable so that you maintain your posture and your balance as you're doing the activity. So it can be here, heel digs, nice and gently, a little bit greater, bring the arms in. If you want to work even harder still, going into a forwards lunge, coming down as deep as you feel comfortable, maintaining your posture and your balance throughout. Tricep kickbacks. So we're going to work the back of the arm. Again, for beginners and post-surgery patients, just moving the arm through the motion, keeping the elbow high, straightening out to the back, using the chair for balance so that you've got a slight lean forward as you're doing the movement. First progression, to take a light weight, again, elbows high, straightening out to the back, controlling the movement throughout. Next progression can be, if you've got the range of movement, to take the weight behind your head and just lift the weight from behind the head to a straight arm position. So we're going to do step-ups now as our cardiovascular exercise. You can have two heights of step. Some steps in your back garden may be a little bit lower, and some steps on the bottom step of your stairs in your house may be a little bit higher. Choose a step that is comfortable to you, and you want to be stepping both feet on and both feet down, making sure your whole foot lands on the step and you're not putting half your foot onto the step as you do it. So this activity wants to be a little bit challenging, so go at a pace that feels comfortable to you. If you need an object to keep your balance, you can use the wall in front of you or anything that is to hand and sturdy to keep your balance throughout the activity. Okay, so we're going to move now into the cool down. So we should all feel quite warm after the workout. So we're going to start off marching reasonably quickly. Nothing too challenging, as we are trying to reduce the heart rate, reduce the blood pressure, and to reduce the breathing. So if you want to start reducing that pace, reducing the amount of arm swing, making it feel nice and comfortable. Concentrate on your breathing. Nice deep breaths as we're going through. Make the pace feel easy to you. Not too easy yet, we will be slowing down further as we go through. So just keep the feet moving and we'll just roll the shoulders back. Nice big movement, or as big as you feel comfortable. Again, swap directions. Just roll the shoulders. And a nice big movement. Go back to marching. Again, the pace should feel quite gentle now. Thinking about your RPE, we're moving back from a 13 down towards an 11, and hopefully by the end of the cool down, bringing it back down to a 9, so a very light activity. So we go back down to the ankles, tap the toes in front, stretch the foot out, across the front of the shin, down the front of the foot, as you get a stretch through each foot. Then back to marching again, keeping the pace nice and easy now, slowing down. Should feel quite gentle. Breathing should be reducing. The effort in the legs should be reducing. We're going to go back to the ankles, dig the heels, curl the toes up. Feel the stretch down the back of the calf. Just maintain your balance. As you're moving a little bit slower, you will need to think about your balance a little bit more. Back to marching, keeping it nice and gentle. Just loosening up the hips, just tap out to the side. Again, nice and slow, controlled movement. Maintaining your posture and your balance throughout. You can make that toe tap a little bit narrower now. And then again, a nice slow march. Should start to feel nice and easy now. Breathing's coming down, heart rate's coming down. Starting to feel a little bit cooler. Still with the hips. Just very gently tap your toes behind. Just grade how far you stretch, keeping your balance throughout. Just loosening up the hips there as we go through. Back to marching again. Nice and gently now. So we'll hold it there. Feet wide. Hands in front. We're going to twist to the right. 1. Nice and gently. Again, rotate at a nice gentle pace, going as far as you feel comfortable for each rotation. And then hold it on the last one. Back to the centre, over to the left. Again, nice and slowly. Feeling the muscles stretch as you rotate to the left. Go as far as you feel comfortable. And then hold it on the last one. Just so we're pumping the blood back up from the legs, just go back to a slight march, nice and gentle. Should feel nice and easy now, nice and light. Then we'll do the side bends, so feet wide, hands on your thighs, and we'll bend to the right. Stretching over as far as you feel comfortable. Can be quite shallow, or you can go a little bit further. Should feel a stretch down the left hand side, and then hold it on the last one. Coming up to the centre, over to the left. Stretching down the left leg. Again, vary your stretch on your own ability. So it can be quite shallow, or we can be reaching quite far down the leg. And then on the last one, just hold it for a slightly extra stretch and back up to the centre. Again, keeping the feet moving just to push the blood back up. Now if you want to, you can keep your feet moving while we do an arm stretch. So just nice and gently pull the arm across the body. Counting for about 15. Then relax. Pull the arm, the other arm across the body. Count to 15. And relax. If you've got the range of movement and the flexibility, you can take your hand behind your head, pull in on the elbow, again for a count of about 15, swap arms, again counting to 15 and relax. Give the arms a shake, and then we're going to finish off with a few leg stretches. So again, make sure you've got some room. Right foot forward, left foot back, left leg straight, bend the front knee. If you want to, you can take your hands behind your back and gently lift away. Hold it for around 15 seconds. Relax in the arms, shift the weight onto the back leg, front leg's now straight. Make sure you've got your balance, hands on your bent leg, lean forward as far as you feel comfortable. Feeling the stretch on the back of the thigh, again for around 15 seconds. Toe down, weight onto the front leg, swap legs, right leg back, right leg straight, both feet are facing the front, bend the left knee. If you want to, join your hands in front and gently push away. Should feel the stretch in the upper back and in the calf at the same time. Relax the arms, shift the weight onto the back leg, front leg's now straight, making sure you've got your balance, lean forward from your hips, hands on the bent leg, and lean forward as far as you feel comfortable, until you feel the stretch on the back of the thigh, holding it for around 15 seconds, and then put your weight onto the front leg and relax. To finish off, we're going to do 3 deep breaths in. Make sure you've got good posture. Just to regulate your breathing now. Nice deep breath, slowly out, and again. Nice deep breath in, and out. Last one, deep breath in, and out. That concludes the workout. Hope you've all enjoyed yourselves, and you will repeat this workout again.